Good morning, and thank you everyone for joining us here today. My name is Sonia Lindell, and I'm the Director of Communications for Florida Policy Institute, or FPI. On May 22nd, the U.S. House of Representatives passed a reconciliation bill that would make deep cuts to healthcare and food assistance. The Senate is expected to pass its own version of reconciliation before a self-imposed July 4th deadline. In a push to protect crucial basic needs programs, 77 groups have signed on to a letter calling upon Senators Rick Scott and Ashley Moody to reject the cuts to health care proposed in the House's reconciliation bill and the SNAP cuts that are included in the House's reconciliation bill and the Senate Agriculture Committee's proposal. With families already struggling to make ends meet in Florida, these cuts would result in widespread, long-lasting hardship for people who call our state home. Florida faces a projected $2.8 billion deficit in fiscal year 2026-27, followed by an increase to $6.9 billion in fiscal year 2027-28, according to the state's latest long-range financial outlook. However, this forecast does not include the costs of major reductions in federal funding, which would exacerbate Florida's ongoing and future budget challenges. Last night, the Florida legislature passed a budget for the upcoming fiscal year totaling $115.1 billion. Federal dollars finance nearly 1/3 of the state budget. If a natural disaster, an economic downturn, or a severe cut in federal funding occurs, policymakers will have a difficult time paying for already underfunded services. Today, we are going to hear from several of the groups who signed on to the letter, along with community members who can speak to the importance of basic needs programs like SNAP and Medicaid. First up, we have Erica Monet Li, who is a policy analyst at Florida Policy Institute.
Thank you, Sonia. Good morning, and thank you for being here. I want to broadly state before I get started that the current cuts being proposed are deeply unpopular to a majority of Americans. A recent Hart research poll showed that once voters know the provisions in the bill, cuts to Medicaid, SNAP, and tax benefits are deeply unpopular, with 71% viewing Medicaid cuts as unfavorable and 72% viewing SNAP cuts as unfavorable. This proposal is largely an attack on the Affordable Care Act. It guts Medicaid and fails to expand marketplace premiums that have helped people finance their coverage. It disproportionately harms working class families, and the consequences could be devastating and irreversible. The reconciliation bill is considering about $1 trillion worth of cuts to healthcare spending, including $800 billion from Medicaid and $300 billion from the Affordable Care Act marketplace. This is of particular concern in Florida, which had over 4.7 million people enroll in the ACA marketplace plans this year, which is more than any other state. The combination of these proposed cuts will increase the amount of uninsured people in the U.S. by 16 million people, 1.8 million being Floridians. These are the largest cuts to these programs since the history of their foundation. It would burden Florida's budget, as Sonia mentioned, which already faces $6.9 billion deficit by fiscal year 27-28. This reconciliation bill, both House and Senate proposed limits on provider rate taxes, which help to finance our Medicaid program. And restricting these taxes creates financing gaps, which leads to lower provider payment rates and fewer covered benefits. We'll see a rise in costs for families across the board, and unfortunately, this bill, House and Senate, will be a double whammy for many families who also use SNAP to help put food on the table. Both the U.S. Senate Agriculture Committee and the House have proposed deep cuts to the Supplemental Nutrition and Assistance Program by slashing billions of dollars in federal funding for SNAP and foisting those costs on states. Although the cuts proposed by the Senate and House are not identical, their proposals are fundamentally the same and will spell disaster for the most vulnerable people in our state, such as children and seniors. Although states have never had to pay for the cost of monthly grocery benefits provided to households, both the Senate and the House have forced most states for the first time to pay a percentage of those costs, with the House shifting as much as 25% of these costs to the state and the Senate up to 15%, depending on their error rates. And most of these errors, which include both under and overpayments, are due to unintentional mistakes made by state agencies, and the families who are overpaid are usually eligible for assistance. This cost shift would put Florida on the hook to pay $984 million under the Senate's proposal and $1.6 billion under the House bill. Imposing costs of this magnitude on Florida, which already refuses to spend $13 million, just 1% of that amount to provide food assistance over the summer to hungry children who qualify for free meals during the school year, puts Florida's entire SNAP program at risk. The bottom line is that all of these federal cuts, without the state money or will to fill in the gap, will force Florida to reduce access to SNAP and other programs in ways that inevitably hurt the people who need it the most in our state. Thank you, Sonia.
Great. Thank you so much, Erica. Next, we have Martha Baker, President of the SEIU Florida State Council and President of SEIU 1991.
Thank you, Sonia, and good to be with all of you. Good afternoon. Martha Baker. I'm a registered nurse for the last, I think, about 45 years. Spent my last 35 years working as a nurse at Jackson Health System, which is one of the largest public hospitals in this country. And, I'm proud to have done that. Jackson is one of the few hospitals that I would always tell elected leaders, this is the way this country should do healthcare. The mission at Jackson since 1919, when the first pandemic hit this country that we know of, Dr. Jackson decided there needed to be some place that we could take these patients who were dying of the flu and put them in a hospital. And Jackson's mission has been, since the beginning of time, for one single high standard of care to all residents, regardless of your ability to pay. Dade County citizens have endorsed that with tax donations for the last 100 years. And again, this is an example of how healthcare should be delivered in the richest country on earth. We are the only industrialized nation in the world that does not give healthcare to all its citizens. The closest we come is with Medicare and Medicaid. This is a shame. The current leadership almost thinks, we believe, well, maybe they don't, but they're acting like they believe that if they cut the waste that we spend on Medicare and Medicaid, that we'll be more efficient as a country. Well, the disease doesn't go away if you cut the funding. This is also one of the few countries in the world where citizens actually lose their houses, bankruptcy due to healthcare costs. This is a shame. We can do better. We've done it at Jackson. We should be an example to this country and the world about how do we take care. Every other country on earth gives their citizens health care because it actually costs less when you do it right. If you offer prevention, wellness, access to health care, prenatal care, nursing homes, for example, in Canada are covered by their public health care. This is a way to take care of your citizens when they need you the most and not lead to profit and bankruptcy and many things that this country does that nobody else does. But this idea that the sickness won't disappear, pushes us to be sick and then be chronically ill. And these 5 chronic illnesses, mostly like, diabetes, heart failure, congestive heart failure, they suck up 80% of the healthcare dollars we spend in this country. And by the way, we spend more than anyone else per capita on healthcare in the world. I think the latest number I've heard is $4.7 trillion per year. That number and those chronic illnesses will only go up if we take away access to our citizens and our residents for healthcare. This isn't right. Healthcare is one of the few entities in life that when you do it right, it costs you less. When you keep people healthy, prevent chronic illnesses, you spend less. That's a beautiful thing. Most of us have to spend more when we want a safer car, when we want a safer home and put in impact windows. Those cost us more to get better outcomes. In healthcare, when you allow access and you focus on prevention and wellness, you lower your costs. Our current leadership is misleading themselves and trying to mislead this country that they need to do these cuts to decrease the deficit. That's baloney. It will only increase the cost of healthcare in the richest country on earth. And it's a shame, I would say, that healthcare has become a profit-making industry. You know, there are entities in this country that make more money, the sicker people are. That's where we will go if we cut Medicare and Medicaid and access to healthcare for so many of our citizens. The Affordable Care Act was a genius that this country fought hard to get. I hope we can maintain it. But Florida leads in access to the Affordable Care Act, and that should help lower our costs in Florida for healthcare, not to mention the health of our citizens and our residents. So this concept of, providing healthcare and access, doing away with that, limiting access to Medicaid is only going to be what penny wise and dollar foolish, as they say. So proud to stand with all of you leaders on the screen and all of you listening in today to put pressure on our electeds to vote for their constituents' interest, not for the billionaires' tax cuts, but to stand strong and for this country to rise up and fight hard not only for democracy, but for healthcare to be expanded in access, not decreased, on the richest country on earth. And we should be proud, I hope, year after year to show improvements in the health of this country. There's no reason we should lead in infant mortality rates as we do. There's no reason we should have a diabetic lose a leg because they don't have access to health care and they don't have a clue that the wound on their leg is due to being a diabetic. We know how to give them insulin at 10 cents a vial to prevent a gangrenous leg and more healthcare costs down the road when a diabetic has to lose an extremity due to their disease. Many more examples, obviously, than those few, but those are front and center, and really, it's crazy and embarrassing that this, again, richest country on earth can't figure out to do healthcare right, improve access for all, and improve the health of our country. So proud to stand with all of you on the screen to fight this fight and push on our electeds to vote the right way. And if they don't, we've got the midterms to change them out. So thank you again to Florida Policy for putting this on. Proud to be here with you. You're on mute, Sonia.
Thank you. Thank you for joining us, Martha. Next up, we have Lynn Hearn, Legal Director at Florida Health Justice Project.
Good morning and greetings from Tallahassee. I'll be focusing on the effects of the reconciliation bill as passed by the House on the ACA, also known as Obamacare, also known as marketplace insurance. These effects have not been as much of a focus of discussion before now because the emphasis had been more on the Medicaid cuts. But based upon the bill that was passed by the House, the changes to the marketplace are now actually projected to cause more Floridians to lose healthcare coverage than the changes to Medicaid. To understand the magnitude of these changes, we have to look at the composition and the importance of the marketplace in Florida. Many of the enrollees tend to be small business owners and employees and their families. Businesses where the employer isn't obligated to offer health insurance because of its size, or it does offer health insurance, but it's unaffordable for either the employee themselves or their extended family. Nationwide, there's 24 million people covered by marketplace insurance, and 4.6, or Erica's number was 4.7, of them are in Florida. So by comparison, Florida has about 4.1 million on Medicaid. So you can see how important the marketplace is. And although Florida is not the largest state in the country, it is by far the largest, has the largest number of marketplace enrollees. So about 20%, or 1 in 5 enrollees nationwide, are in Florida. Our enrollment has been rising steadily since 2020. And as I said, for the last few years, it has been the largest state in terms of marketplace enrollment. So Floridians are clearly hungry for affordable health insurance, and the availability of marketplace coverage has been a welcome answer to this need. But now there are two separate significant forces that are combining to negatively impact marketplace coverage. The first is not in the bill, and the second is what's in the bill. So what's not in the bill is the extension of premium tax credits. In 2021, Congress expanded the availability of premium tax credits to make marketplace plans more affordable. This has been wildly successful and been driving the increased enrollment in Florida and other places. As of today, the vast majority, more than 90% of enrollees in Marketplace have access and qualify for the advanced premium tax credits. Now, those are due to expire this year, and the reconciliation bill does not extend them. That's very significant for these enrollees. For example, the experts predict a 75% increase in premium costs for those that would lose the premium tax credits. So for an example, a family of four with an income of $126,000 a year, their premium would increase by $9,000 a year. So obviously this is going to make it unaffordable for many people, and experts expect that the loss of these tax credits will result in 4 million individuals losing marketplace coverage nationwide. The second force, which is in the bill, which is actually a million individual forces, are a variety of cuts that are proposed in the bill. And I don't have time to go into any detail, but just broadly speaking, I'll mention 4 categories. One is reduced enrollment periods. The bill significantly shortens the open enrollment periods, and it also eliminates special enrollment periods for low-income individuals. Number 2, increase in burdensome enrollment and renewal processes. It will now require significant documentation for upfront eligibility for the premium tax credits. Think passport, birth certificate, marriage certificate, income tax records. Those will be required in order to be eligible for the tax credits upon enrollment, and also significantly every year upon renewal. Think of employer insurance that automatically renews. Imagine if every year, every employee had to provide their birth certificate, marriage certificate, passport. A lot of people would just drop off. And that's kind of the irony of this change. It's the healthy people who can afford to drop off. Oh, they didn't get the form in, and they figure they can take a chance to be without coverage for a year. The people who have real need of ongoing health insurance, they will not let that happen. And so then we'll change the pool, the risk pool of people who are covered. So it's a race to the bottom. The third cut in the bill is reduced eligibility. It limits non-citizen eligibility for premium tax credits to lawful permanent residents and certain categories of Cuban immigrants. Whereas before, you didn't have to have a green card. So long as you were lawfully present, you would be eligible. But now it's substantially limited. And then the last cut is just plain reduced coverage. It increases the out-of-pocket maximums and allows for increased premium. So in sum, if the bill passes, the 4.6 or 4.7 million Floridians who depend upon the marketplace for healthcare coverage will soon find that coverage inaccessible or unaffordable. This time, Congress might not be calling it an outright repeal of the ACA as it did in 2017, but a program that is inaccessible or unaffordable is as good as repealed. Thank you.
Great. Thank you so much, Lynn, for summarizing some of those health provisions. Next up, we have Asheena Moses, who is the statewide outreach and advocacy manager at Florida Impact.
Good morning, everyone. Thank you so much, Florida Policy, for providing this platform for us to speak about this beautiful bill. I'll be speaking on how this bill the SNAP cuts will impact families. First and foremost, in Florida, we have over 2.8 million residents who depend on SNAP. And with inflation and rising housing costs in cities, especially like Tampa, Miami, and Orlando, the household budget is being squeezed, meaning more families will be in need of this crucial resource. Cutting SNAP during this time only deepens the burden on low-income families. Seniors and people with disabilities make up a growing share of enrollees. For many, SNAP is the difference between affording groceries or going without meals. Every $1 in SNAP benefits generates up to $1.50 in local economic activity. So it's not only beneficial for families, it's also beneficial for Florida's state economy at large. Florida grocery stores, farmers markets, and food producers all benefit from SNAP spending. Cuts will hurt small businesses, particularly in rural and low-income areas where SNAP dollars are vital. This is also a burden on charities and food banks. For every meal a food bank provides, SNAP delivers 9. This is a scale problem, and food banks can't solve it alone. Food banks are already operating at or beyond capacity. So cutting SNAP would put them in a position where they'd have to turn families away. This is a strain on local government and public service. More food insecurity leads to higher demand for emergency assistance, school meal programs, and healthcare services. County health departments, school districts, and shelters will all feel the pressure. It creates a domino effect, higher social costs that taxpayers ultimately have to bear. Um, this the, Finally, the SNAP cuts will affect children's education and development. Hunger impairs memory, concentration, and behavior in school-age children. SNAP helps stabilize children's environment so that they can learn and grow. Cuts will widen the education gap, especially in underfunded districts already struggling. Through SNAP and through direct service certification, school districts that participate in the school lunch program match the names of children living in households that receive SNAP or food distribution programs on Indian reservation benefits with school enrollment records. This match is then used to certify students for free school meals without the need for their families to complete a school meals application. So basically what it's saying is that they use the names of students who are enrolled in SNAP in their household, and they use that as a way to directly certify the school as a community eligibility provision school. And what CEP is a program that allows all of the students to eat for free. This reduces the cost administratively for the food and nutrition services at the schools. It reduces the stigma that students who are on free meals experience. And it also reduces the large mounting school meal debt. Because even for the areas that don't participate in CEP, the schools are still feeding the students because they can't turn them away, but they have mounting school meal debt that's not being taken care of. One of the things that I took pride in that Florida Impact was able to do is to connect school districts who have successfully implemented CEP with other districts so that they can show them how to implement the CEP program. And for a while, we were going good. I think we were about 8 or 9 counties in that were CEP countywide. So this is a threat to that type of programming, and we took all those steps forward, and we're going to be pushed back. This is not on my talking point, but I just want to raise the fact that I did a roundtable with Congressman Maxwell Frost yesterday, and the overwhelming response from all of the organizations present is that people are scared. Constituents are scared of what's going to happen to them, how they'll be able to provide their families with health care, how they'll provide their families with food. There are families who are just trying to get themselves on their feet. They can't, they don't qualify for Medicaid. They don't qualify for food stamps, but they qualify for the ACA. And they use that to get health care for all their family members. What happens when those costs go up? So now they're putting them in a position where they were getting to a place of self-sufficiency, and now you're pushing them back. So all of these things need to be taken into consideration. This is a horrible bill, horrible, far from beautiful. It's a horrible bill. And our senators really need to hear the voices of constituents. The organizations here speak on behalf of constituents, and no one is looking for this bill to be passed. So they need to do something. They need to stop it immediately.
Great. Thank you so much for your remarks, Asheena. Next, we're going to hear from Reverend William Lawrence, a faith leader in the Palm Beach County area. Thank you for joining us. And I think you're muted right now.
All right. Good morning to everyone. And sorry about that. And I am glad to be here. And we're talking to you from out in rural area of Florida, which is Belgrade, the winter vegetable capital of the United States. And we are here to stress how the cuts in SNAP and the ACA program will affect, from a human standpoint, it would devastate the Glades area. We have three cities that are located out here in the rural area of Palm Beach County, which happens to be one of the richest counties in the state of Florida. Also happen to be the county of the home of our current president. And so we are looking at cuts in SNAP that will affect the three cities that operate out here in Belgrade, South Bay, and Pahokee. And these cities operate with 28, 27, and 25% of their population, which is unemployed. We also have a very high precision of migrants that live in this area, that migrate back and forth in this area, because we have the farm areas that need to be developed in this area. And they heavily depend upon the resources from the ACA and from SNAP benefits. And so these cuts that we are talking about, these cuts that they are trying to propose, are going to devastate families and homes and individuals that live. As we know already, that we saw this past week, the president is rethinking concerning farmers and what is going to happen and how it's going to devastate the farm industry. And we are heavily divested in the farm industry because that is our main product here in the Glades. And so for me, as a clergy in this area, and as for me, along with other pastors that are providing food giveaway programs through TAF and through our farm share programs and through our food bank programs, we're seeing cuts and devastation to these programs already. And so the SNAP program is going to be very devastating to our area. A majority of our families really depend upon the SNAP program. And I'm just urging our senators, and we're urging our congressmen to really seriously take a look at what is they're getting ready to do that's going to devastate the homes and the livelihood of people. And as the other speaker just already said, that already struggling and trying to get on their feet. And now we're seeing these major cuts that are coming to these programs. And we're really afraid. We really don't know what to do. And we're trying to mobilize ourselves together to come up with ways that we can be of assistance. Families are coming into our offices and are asking for help as we speak now. And so we urge Congress to take a look at this and to really consider what they're about to do in the lives of individuals that are living and operating down here in Florida, that are still going out into the fields and harvesting these fruits, harvesting these vegetables that were being shared all over the United States. And so if we're going to make America great again, we need to think about these people that are working in these fields that are providing the goods to those citizens in our communities. Thank you very much.
Great. Thank you so much, Reverend Lawrence, for joining us and for providing your remarks. Next up, we have Michelle Mastrototaro, Tampa resident, who is going to speak a little to how important basic needs programs are.
Good morning. My name is Michelle Mastrototaro. I have a son who is 16. His name is Bryce. We live in Tampa, and we love to go walk, and we love to watch the sunset. Our lives have been unfortunately highlighted in hardships, but we have faced it head on, and we have persevered every time. My son Bryce, he was born blind, and he has battled several chronic conditions throughout his life. He also has autism, which communication and challenges require specialized care and a unique approach to treatments. And later And last year, we had our home destroyed by Hurricane Helene and Hurricane Milton, and we lost everything. Needless to say, recently we've just had another hurdle come our way, which is, my son Bryce was diagnosed for the second time with cancer. This time he's got stage 2B Hodgkin's lymphoma. He is starting chemo, and the chemo ended up getting an infection in his port. So we're still in the hospital battling his sickness on top of sicknesses. There are a lot of sadness in my life. It is emotionally, mentally, and physically draining to see my son go through this pain and suffering. I pray every day for my children and for their safety. And Bryce is in his recovery, and I'm public about my family life. I have nothing to hide, and I'm here as a fighter to fight for what is right. But there's other families out there that don't know how to fight and don't know how to advocate for themselves through their own trials and tribulations. While my family is going through this crushing moment, our senators in DC are discussing possibly cutting programs that help families like mine, Medicaid, SNAP benefits. I have been able to help us get through this rough time in our lives, and the programs are not perfect, but they are a lifeline for people. And our family is trying so hard to make life work right now. I've had to step away from my job to take care of my son. Money is very tight. With Bryce's procedures, treatments, diets, and daily living expenses add up. And we've seen the impact. And we've seen the conversations with DC and the future of what they're trying to do. And if the healthcare providers, we don't need any more stress than we have already been going through and hearing all this. Our heads, with their lives are on the line here, and we have to really think about this. As a mother, I will do anything to help my family. I ask senators to think of families like mine when they consider even an ounce of cuts. The thing is, you never know what's going on in someone's life. And my neighbors, my community members, what's going on through theirs. And how is Congress, my question, how is Congress directly helping the people they are electing to serve? Step into our shoes and see how critical these benefits for our families all across the nation. And we need to stand up. And, I thank you for listening to my story, and I thank you for your time.
Thank you so much, Michelle, for sharing your story and talking a little bit about how important, these programs and services are, and what it would mean if they're cut. So thank you.
Thank you.
Our last speaker of today is Christine Trujillo, who is a Miami resident and
Hello?
Yep,
Hello?
I can hear you.
Yeah, kind of froze. Okay. Hi. Let me tell you a little bit about myself. 5 years back, just before COVID, I was in an accident. Supposedly they let me out at the hospital telling me that I was okay. I had to push myself really hard to save whatever we could salvage for if we ever did get housing again, because at the time a lot of landlords were illegally evicting people because places shut down. You couldn't function during a pandemic. We wound up in a shelter. and they wanted to separate us. They wanted to put my mom and my stepdad in a nursing home, and they wanted to separate me from my 14-year-old son. It wasn't easy. I had to fight for a year and a half to keep us together. Sign up for programs, because no matter how much you were looking for work, work wasn't available, not even to work from home. Right now, on February 5th, my mom suffered a cerebral stroke with a heart attack. It left her paralyzed from the neck down. Without Medicare or Medicaid, I wouldn't be able to get her the help that she needs to have the rehabilitation and the attention that she needs. Without the food stamps, we wouldn't be able to eat. I'm here looking for work every day. I'm sending out hundreds of resumes, and I'm still not able to get a job. If it's not for the food stamps, we wouldn't be eating. If not for Medicaid, I wouldn't even be able to take care of myself. I'm a diabetic. I need insulin. Do you know how much a vial of insulin costs? It's very expensive. For people like us that we're trying, it's not that we're lazy, that we don't want to work. We're actually trying, but the economy is not helping. I myself am 54 years old, and I'm looking for work to restart my life over. And there is practically no job for me, not because I'm not qualified, but because I'm either too old, I'm not young enough, I'm not perky enough. And according to them, I cannot do my job. They give a job to someone who is less qualified. These programs help people that are struggling to try to get on their feet and be on their feet. Gives them the medical attention that we need. Because there are a lot of diseases out there. There are a lot of sicknesses, things that people need to take care of to prevent a pandemic. You take these benefits away, and what are you leaving people with? It's really upsetting to see people that have not walked a mile in other people's shoes. They can sit there and criticize and say, oh, it's because they're lazy or they don't want to work. No. I'm one person that I want to go out and work. I prefer to work than having to struggle and recertify all the time or get threats because I have a Hispanic last name, even though I was born here in the United States. Oh, we'll deport you. Deport me where? I might actually do better in a third world country. These are things you have to think about. We're all here, and I'm still rebuilding my life from 5 years back from the pandemic, and I haven't been able to move forward. If it's not for these programs, I don't know how we would be surviving. I don't know how I would even have the roof over my head that I have now. It's thanks through these programs that are out there that they want to cut or take away that I'm able to provide a roof over my head. I can keep my mom alive and hope that she can be rehabilitated to be able to bring her back home. I'm urging you and I'm pleading, please reconsider. You're hurting a lot of people. Thank you.
Thank you so much, Christine, for sharing your story and your experience and the challenges that you've been facing. And I think it is so important to realize that these are real people who these cuts are impacting. So thank you so much for being with us here today and letting folks know how important the programs are and why it would be devastating to cut them. We're going to take some questions now from members of the media. The speakers, you're welcome to turn video back on if you'd like. You can ask the questions using Zoom Q&A, or you should be able to use the raised hand function. I think we already have a few here. So we have a question about Lynn, in the example of a family of 4, I think this was a question about how much premiums would go up if the ACA enhanced premium tax credits aren't extended. And I'm not sure if we have that figure handy. If not, we could certainly follow up. You do? Oh,
Yeah,
great.
I do. Yeah, I thought I said it, but if I didn't, and this is for individuals that are over 400% of the federal poverty level. The enhanced tax credits made premium tax credits available to those individuals in addition to lower income folks. So it would increase if those go away, which it appears that they're going to. This family of 4 with $126,000 income would face a premium of $9,000 a year.
Wow. Okay, let me see if there are any other questions. To Christine and Michelle, you had a thank you for sharing your stories from one of the attendees.
You're welcome.
Thank you.
So we have a next question. Some proposed federal cuts will eliminate HIV prevention and surveillance at the CDC, housing, and other programs, amounting to cuts of over 1.5 billion. Any insight on how this might affect people here in Florida? Do you think this will overlap with those who are on Medicaid and/or SNAP?
Most likely.
For this question, we might have to follow up with you offline regarding this particular cut. So Sophia, we will follow up with you via email. Do we know how many Floridians will lose ACA coverage?
Hey, Christine. I'm going to direct you to kff.org. They have done a very detailed analysis. They have an article titled, How Will the 2025 Reconciliation Bill Affect the Uninsured Rate in Each State? They have some charts. I have been studying them. It's very complicated, and I don't want to misrepresent what they're saying, but it appears to me it's at least a third of the individuals enrolled in the marketplace. But take a look at that, and I think you'll find it a good source.
Question for Michelle. Um, are you comfortable mentioning what programs you are currently on? Do you have ACA coverage, or is your son on the Medicaid program?
He is on Medicaid program, yes. And they're right now trying to kick us out of the hospital because he had a very bad bout with not doing well with his chemo, and he couldn't do a bowel movement for 6 days. And now he's not eating and he's throwing up, and they want to kick us out. And we lost everything during Hurricane Helene and Milton. And the room that's only available for him is the front room. And we've not tackled it yet because funding is really bad for us. And I'm only a seasonal worker. I'm a teacher's aide, and I only work during school, and I'm off during the summer. And with his chemos running back and forth, and I don't have his bed ready, and they have a hospital bed that he is supposed to be getting delivered and respite for a nurse for me, and they don't even have that in place, and they're trying to kick us out. And his chemo is Friday. And so I don't really understand how they can kick people out when he's going to come back Friday anyway. But they said the insurance won't cover it. Sam. His food stamps, he gets 200. His food alone a month, his specialized food is about $460 a month. And it's really, they're really making these families go through a hardship. And it's very sad.
And is it the Medicaid iBudget program?
It's just regular Medicaid, Sunshine Health.
Okay, that was a follow-up. Thank you.
Thank you.
How would these cuts impact folks in rural areas, and how does that compare to urban areas? I'm trying to think if any of the national groups have done this. I'm not positive if I've seen a report on that yet, but maybe Erica or Lynn might have some insight.
I will go ahead and say that we know that disproportionately these cuts will impact folks in rural areas more so than urban areas. And we've just seen that based off of broad analysis that has been done by our national partners. And this is something that we continue to see is rural areas are often disproportionately impacted by things like when for when there are things such as hospital closures, cuts to programs that support safety net and things like that. It's a disproportionate share of those areas that suffer. And so we can follow up with more specific resources if you care to hear more about that. But yeah, we just know that generally these cuts never bode well for rural areas either.
Not only that, there are grocery stores in those rural areas that rely heavily on SNAP dollars, that if they're not getting those SNAP dollars, they will end up closing. And that makes that area even more, it intensifies the food insecurity in that area, makes it an even more, like, I can't think of the word right now. But yeah, those stores will definitely take the hit from the limited SNAP dollars, and they will have to close.
And we also know that people who live in the rural areas are more likely to have higher poverty rates and fewer employment opportunities. So this really does hit them very hard.
I think that about wraps up the question and answer portion. As a reminder, anyone on the call, any attendee, you can follow up with me at Lindell at floridapolicy.org. I will be sending around a link to the recording and the letter as well that all the groups signed on to. So I would like to thank all of our speakers for joining us here today and sharing their experiences and their stories. And thank you to our analysts for talking through some of the data as well. Obviously, this is a really urgent issue, and as noted in the letter, we urge Senators Rick Scott and Ashley Moody to reject the cuts to healthcare and food assistance. Thanks, everyone. Have a great day.
Thank you. Bye.
Thank you. Bye.